Welcome to Ask Your MP. My name is Oluka Jamila, and this is yet another episode of Ask Your MP. And this time around, we have brought a very special group of MPs. Actually, Honorable Nalule Juuko Safia, the representative, the national representative of people with disabilities, alongside Madam Namboze Mariam, also working as a social worker and a person living with a disability. But today we want to look at Ask Your MP in a different perspective, because from what the people asked, we have a special group that we talk to on our Facebook page, Ask Your MP. You can log in now so that you can keep the conversation going. And there are so many questions they ask because they vote for these members of parliament and they want accountability of what have they done to help the people living with disability. And there is a lot that most of us do not know, because even understanding the issue of people living with disability, it is something that you need to understand. And today, Honorable Nalule, who has been a politician for a very long time, who will be telling us a lot about people living with disability. So, Honorable, you're most welcome. I would have loved to shake your hand, but because of the issues that are at hand, health issues, we'll just say hello, because the president said you say bong and then or you say hello. So you can introduce yourselves, because I know that the voters who voted for you are actually interested in hearing from you. Yes.
Greetings to everybody. I thank UBC for bringing us today to give accountability to the people.
Yes.
My name is Hajat Safia Nalule Juuko. I'm the National Woman Member of Parliament representing persons with disabilities in the Parliament of Uganda, and I'm also a board member and founder member of the Human Rights of Women and Girls with Disabilities organization.
Yes, and also more things that people are yet to know about you. And Madam Namboze Mariam, kindly introduce yourself.
Thank you for hosting us at UBC. I am Namboze Mariam, and I was once a KCC councillor.
Yes.
And I am also a programs officer with Human Rights of Women and Girls with Disabilities.
Yes. So what is exciting me? What is exciting me is one thing. Everyone, especially people living with disability, I have interacted with some of them. We have some of them who work with us here, and they're actually right now watching, and I think they are very excited because we spoke to them and I said, you know what, today, make sure you engage with the honorable and the social worker. And you coming from the background of being a social worker, I know that social workers are the best people you can speak to, and you understand people, especially on the human resource part of it. So, honorable, my first question to you is, and you can help honorable at any time you feel you need to interject. I want to ask you, this is a question that was posed by one of the voters, I think in your association with Nudipu, and the question was, I'll just say how the person said. The person said, what have you done for people living with disability, especially the category of women, you being a women's representative?
Okay, thank you very much, Jamila. I can say that automatically when I was elected to be a member of parliament, I had served the disability movement in different categories.
Yes.
I was the board member of Nudipu. I was one of the founder members of one of the organizations for women with disabilities. It was called Disabled Women's Network and Resource Organization in Uganda. The president appointed me one time as the commissioner on the Constitutional Review Commission, which was the Sempebwa Commission. I'm known, you know, one time when we were being trained as politicians and we were being told that in politics you must make sure that you leave a legacy.
Yes.
So you may find that in the corridors of parliament you may find me being called special needs education.
Yes.
The other day you will find me being called certificate of gender and equity compliance.
Yes.
Then the other day you will find me being called labor beds, accessible labor beds for mothers with disabilities. Then the other day you find people calling me special grant.
So basically you're all-round person when it comes to that area.
Yeah, when it comes to that area, I would like to say that when I went to Parliament, I found that on the side of education, automatically we still have that problem. Children with disabilities, they don't have the adequate numbers of teachers specially trained to teach them. They don't have scholastic materials which are friendly to their disabilities. You find they don't have enough sign language interpreters, and so on and so forth. The distances are so long to go to the school. They don't have appliances, and so on and so on. So, but the worst thing was that as much as we were grateful to government that
yes,
there is a special needs education department.
Okay, so you've talked about special needs education department, but also what I would like to ask you, actually I know that people watching out there know this, because one thing that one of the, I think I read it on Facebook, someone was asking that there's an issue about education, and that issue about education is there are very few schools. There are very, very few schools that help people with disabilities. Because when you look at people living with disabilities, we are not looking at only someone who is physically disabled, but there are people who are mentally disabled. There are people who cannot hear. There are people who cannot see. So it is just a category of so many people. There are people who become disabled at maybe any time you can become a disabled person. So either mentally or physically or emotionally, even people living with who are depressed. That is someone also, I think, who is disabled because they're not in a good state of mind. So that is the thing that I want you to talk to us about today, and I know that people who are watching really are interested in knowing that.
Yeah, Jamila, that's where I had started from, because the question was, what have you done?
Exactly.
So I started like that just to give the broader picture. When I went to Parliament, I found that government had already established a special needs education department in the Ministry of Education.
Yes.
That was very good. But the problem was that the budget for special needs education was combined with that one of guidance and counseling.
Yes.
So it was very difficult for us as representatives of people with disabilities to actually know how much can go to special needs education, given that the burden, as I have already said, is so big.
Yes.
Then we struggled to get a specific budget vote for special needs education. But you know, when you do that kind of advocacy and you succeed, it will be paramount that the other actors, maybe in the NGO sector,
yes,
or the councillors representing persons with disabilities, they also, when you tell them, they must pick it up and follow it up,
yes,
so that that budget is reflected in the local government budgets, and then it benefits the students with disabilities. Secondly, for me, when I went to Parliament, I was always asking myself, because before I went to Parliament, I was a councillor.
Yes, and
with the Kampala City Council.
You've been in Parliament for quite a long time.
Maybe I don't know what you call long, but I've been in advocacy, yes, for a very long time.
Okay.
Because ever since I left university, I worked with ADD. It was advocacy. Then I was a councillor at Kampala City Council, and then I'm a member of Parliament. But what I was looking for, now that we had affirmative action provisions in the Constitution, where is the money to actually implement the concerns of persons with disabilities? In Uganda, we are excellent in as far as having very good laws is concerned.
Yes.
So my target was to look for money. I couldn't see the money, Jamila. I was in city council, I was asking them, because disability issues are cross-cutting.
Yes, they are cross-cutting.
Then, I started on my journey when I was in city council. Those of numbers, they know. I started by asking for money which was allocated to celebrate the International Day of Persons with Disabilities,
Yes.
that part of it should go to the groups of disabled people, so that when they celebrate the International Day, they don't go back when they are crying. At least they go with some money to put into their businesses. That's where I started. So when I went to Parliament and I found that one of the cardinal roles of Parliament was budget appropriation, I've done like 3 things. I looked for them and I couldn't find it in the different sectors. But then when we're enacting the Public Finance Management Act,
Yes.
I came up with the idea of the certificate of equity compliance.
Yes, that's
So when
which is very important.
which
when
is
you're
very
getting it.
important.
Yes.
So because for me, I thought that maybe with equity, then I will be getting money for disability. So when I went to the Right Honourable Speaker Kadaga, I shared with her the idea. She said that how come that, Safia, you are having the same mind like mine?
Yes.
Because for her, she was already she had started thinking about the need for a certificate of gender compliance.
Yes.
So we added the 2 ideas, and then we came up with the certificate of gender and equity compliance. So basically what this one means that before, when the Minister of Finance brings the budget framework paper to Parliament,
Yes.
to be passed, we cannot pass it when it's not accompanied with this certificate of gender and equity
I remember
compliance.
last year it was a big issue.
It was a big issue, and
Yes.
Parliament had to be adjourned.
Yes.
But you know, it doesn't happen only to the national budget framework paper. It also happened to the sectors. They have to be certified
Yes.
before their budgets are brought. But now we still have a problem. You know, when they are certified, they are ranked according to what they have done, what they have catered for in their budget. You know, maybe with the youth, with
Yes,
the women,
men,
with the children,
and the
with the
people,
people with
the elderly
disability,
people.
the elderly, and they have a pass mark. So if they get the pass mark, they go. But when we go back to analyze these budgets, you realize that they pass, but without giving due consideration to issues of person with disability.
But
I've just
Honourable,
been, Jamila, I
yes.
just want to finish up this.
Yes.
I have just been to Nairobi.
Yes.
I was invited by the Association of Members of Parliament representing persons with disabilities to do a benchmark.
Yes.
But what I found in Nairobi, for them, they don't have a certificate as such, but they require that before any budget of any sector is passed,
Yes.
it must have catered for issues of person with disability.
Disability.
And it is person with disabilities themselves who actually analyze that sector and actually say, fine, you have catered for issues, your budget can pass. But for us here, what I would like to request Parliament also to do is to amend, you know, maybe like the policy or the structure of these institutions which do the certification, to make sure that they are representatives of persons with disabilities. Maybe they are representatives of women,
Yes.
they are representatives of the other marginalized groups, so that we make sure that the issues are catered for. Because the Public Finance Management Act says that this certificate must show how the sector has catered for issues of women, persons with disabilities,
youth, the elderly. Yes.
But now, because the rating is given marks,
Yes.
these issues are not yet coming out very well.
And now you as a member of Parliament, since you have already elaborated for us all that issue, what are you what is your way forward on helping to work on that particular issue? Since you already came up with a certificate, which you suggested, and the Honourable Speaker, the Right Honourable Speaker, ordained it. Now, what is the way forward? Because from what I know, this certificate has not been operational for a very long time.
Yeah.
Yes.
It is just since 2015. But we have in Ministry of Finance, we are like, I think, let me take this opportunity to thank the Ministers of Finance. Honorable Kasaija, Honorable Bahati,
yes,
Commissioner Mugambe Kenneth,
yes,
and then my dear ladies, Margaret Kakande and Safia, because we have a task force, a national task force in the Ministry of Finance on gender and equity budgeting. It's really working very hard, and actually the way forward, I'm going to do two things. I'm going to tell those people on the task force,
yes,
that we may do away with the rating using the percentages.
Yes.
But let us look at real work.
Yes.
What has the ministry ABCD done to comply with the provision of the Public Finance Management Act?
Yes.
Also in Parliament, we have what we call the rules of procedure. We can go into the rules and then we make those details as requirements.
Thank you very much, Honorable. You know, you've elaborated a lot, but I'm still going to come back to ask you, because from what I have researched from the people who asked on Facebook, and also some of the people we met earlier on today, they had said there is a grant that was given on women, I think sexual reproductive health rights. You will tell us more about that, but before I bring you back, let me ask Honorable Madam Namboze Mariam, you have also been in this field and you have worked as a leader from KCCA. Now you are a professional worker. You also now a program officer who is in charge with helping people with disability. What can you tell us? Maybe you can take us through and then tell us exactly what you do.
Yeah. If the biggest challenge that we have faced as leaders is, for example, as I was in KCCA, most of the monies were in consolidated fund. They were taken to the authority. Yes. So it was very, very hard for us to articulate issues to do with PWDs. Yes. Because, you know, before the merger into KCCA, we used to have a vote for PWDs, but that all the monies were collected into a consolidated fund. So you would find that however much you would, for example, like to begin issues to do with ordinances, yes, you would not implement them. If you wanted issues to do with, for example, organizing workshops, it would be very hard for you to do it. And in most cases, you would find that when you go back to the people, they do realize that you're doing nothing for them. you're a leader who is doing nothing for them. But the issue is that when they removed that vote, it was very hard for people with disabilities, the leaders, to access any monies to articulate issues to do with PWDs.
Actually, at a certain time, I think that was about 2015, either 2015, 2014, I was KCCA trained us on something about reproductive health, and one of the issues that kept coming up, and up to now, when you talk to people with disability, they talk about issues of not being able to access public places. And you have worked with KCCA, and KCCA happens to be a central authority here, and we know that in Kampala, at least, where so many buildings really need you to be physically fit, or at least being able to walk through the place. Like now, I can give you an example. If you come to UBC, you will have to use maybe a lift to reach up, maybe to the 3rd floor or the 5th floor. But now, people are not able to access that. But you have worked in this sector of KCC, and also you're a member of NUDIPU. What have you done so far as a social worker to address these issues? And then how have you worked with the member of parliament?
One is that we try as much as we can to empower people with disabilities to come up whenever they see issues to do with inaccessibility of public places. What we do is that we educate them about the act, that provides for accessibility in public places, but the contractors go ahead to play dumb.
But what? Okay, now let me just interject a bit, because now you've talked about the contractors. Let me just come back to the member of parliament shortly. You are a legislator, and when she talks about the contractor, this has been a very prevailing issue. People contract houses and also public places, and they don't provide for people with disability. In the situation that is happening right now, what is at stake?
Okay, I would like to thank Mariam. What actually transpired was that I don't remember the year, but I remember, I think it was my first term in parliament. In the 8th Parliament, we enacted a law called the Public Finance Management Act. Actually, one of the provisions is actually providing for accessibility, maybe to when you are constructing a house or a public facility.
Yes.
But what is happening, some people are complying. Some people like UBC, they are not complying. When we were coming in here, we actually were happy that there was a ramp.
Yes.
But the lift was not here. I've always asked the manager, why don't you bring at least a request and then maybe we ask for a supplementary so that this place can be accessible.
Now that you've seen that,
because
please
it is
go back
public,
and tell them.
It's a public place. But now what we are saying, for me, what I'm happy with, is we'll pass this law.
Yes.
Because, you know, Ugandans are good people. When we started complaining about accessibility, they started, you know, they started, you know, putting ramps everywhere.
Yes.
Because by that time, what people actually understood by accessibility was ramps.
Yes.
And you know, they never built these ramps according to specific standards. So you could find one is so steep, the other one is so slippery, but they had tried. It was a very good start. But now when we are enacting this law, we made sure that we also put specific calculations. For example, for a ramp, how can this ramp be looking like?
Yes.
If we are talking about, you know, whatever, you know, we have specific measures in that public finance management. I mean, the Building Control Act. But now, to go back to the question, of course we have the law.
Yes.
But with construction, I don't think we have enough enforcement staff to ensure that, you know, all buildings are accessible. And, you know, also maybe what I can say, most of the things people would not like to hear, but people with disabilities, they must be there to check the excesses of the other actors.
Yes.
But you know, sometimes somebody may be like a planner or whatever, building instructor, and is not concerned and cannot remember very easily.
Yes.
That these people are there.
Yes.
That's why I want to go back to thank His Excellency the President. You know, for him, he normally uses a word that for those ones who, for example, if you are serving a meal, there are those ones who are not very powerful.
Yes.
But you must, you know, so if people can actually take up that principle in all what they do, that they can always remember that there are those people who have to be served.
Yes.
Even actually with this grant, when we had a meeting with the Presidential Advisory
Maybe
Committee on
Honorable, to break it down clearly, you could tell us what grant in that order so that we understand. And I want you, when you're telling us, at least look at the people out there, let them understand what this grant is, and then after, because my interest here is accountability. At the end of it all, I want accountability, and my sister Namboza will help us to really break down, because she's the member of parliament. You have worked closely with her. So I want to know from you, who is on ground, has this grant worked? That is what I want, and I'm really interested in this grant, because since you've already got it, please take us through.
Okay, maybe let me when you know when I talk about a grant in the disability community, it's like a home like name. You know, when you talk about the disability grant, everybody just knows. For those who know the grant, they know. In the 8th Parliament, when I told you about, you know, the genesis of this grant, we found there was the Disability Act of 2006, and one of the provisions in the act was requiring that the Minister of Gender has to give Parliament a report of the status of employment of persons with disabilities every year, which is not happening.
But do you do that? Is
then secondly, there was another provision which was saying that for those private employers who will be employing persons with disabilities, they will get a tax waiver. By so doing, actually, the provisions were trying to make sure that the person with disabilities get employment. But then we realized that those provisions were catering for those persons with disabilities who had gone to school. But those ones who had not gone to school, you know, they are in the informal sector. They are in the informal sector, and you know, they needed also to be catered for by means of getting maybe some money, and then so that they can boost their working capital.
Yes.
So that's when we came up with the idea of this disability grant. We asked government to provide some money which we can give to persons with disabilities who are doing their businesses to boost their working capital. So initially government approved 3 billion shillings, and we have realized that 3 billion is so little.
So 3 billion in a financial
year. Because when we go with the State of the World Disability Report, which was compiled by World Bank and WHO, they say the population of persons with disabilities is 1/7 in every population. So if the population of Uganda is 42 million persons, 1/7 is almost 6 million disabled people.
Yes.
When you divide the 3 billion by 6 million, you get like somebody getting 500 shillings.
Which is
this is the type of reasoning I shared with His Excellency the President, and then when I was substantiating why the grant has to be increased.
Yeah.
Initially I was asking for 12 billion, because 12 billion I thought that each sub-region can get at least 3 billion shillings.
And then also different sectors, maybe
different
the youth,
sectors and then the administrative costs. No, ours is purely for disabled. There is WEP for women, there is YLP for youth, but ours is
does it cater for all disabled people in all categories?
Yes.
The mentally, the what?
Yeah, that's why we said that the grant is so small. That's why I was asking for 12 billion. But then, you know, with limitations in financing, we have got an increment of 2.1.
Oh, which is good.
Well, you know, so now we are grateful to the president, we are grateful to the ministers, and everybody who has played a role. But now, what we are saying now, having got experience of how we are sharing the 3 billion, we want now to come up with better guidelines and management, you know, so that person disability majority can benefit. So when I talk about the grant, this is the grant I'm talking about.
But I also remember she had mentioned something about that grant, the one which focuses on sexual reproductive health rights.
Okay, thank you very much. Briefly, I can also talk about this one. Now, under the human rights of women and girls with disabilities, we are supported by Amplified Change with the grant to do advocacy on sexual and reproductive health rights and needs of women and girls with disabilities. Initially, we were supposed to do a baseline on the facts and figures of the needs of on SRHR needs of women and girls with disabilities. But having got the facts, we asked them for another grant to help us focus now on budgeting and legislation. So basically what we are doing with this grant, we are advocating for enactment of ordinances. These are laws at local government council.
Yes.
And we are doing it in Luero, Mbarara, Wachiso, and Masaka. Yeah,
why those selective districts? And yet when you look at issues of reproductive health, according to the report by Ministry of Health, the issues of reproductive health are mostly faced by people who are living in upcountry. For example, I will tell you when I was in Dokolo, what I saw there was really devastating. And I think we talked with a member of parliament from Dokolo, Honorable Amoro Paul, about the situation of girls. I'm telling you, Honorable, we're able to see girls, with the children from here, we're able to see girls of 14, 15. You get it, pregnant. And now you imagine someone who is disabled, and some of these girls, people use them for witchcraft. That is apparently what is there.
Yeah.
So I think you know all the things. I don't need to tell you.
Yes,
so
yes,
that is why I want you to really give us a deep understanding.
Also, this one had a background. You know, when you look at these districts which we selected, of course there was a criteria. I may not have enough time to go through the criteria, but basically I can pick out like districts like Ruero. You know what it has gone through.
Yes, yes.
With the wars and so on. And you know, with looking at person with disabilities as a burden. When people were struggling, to get up.
Yes.
Then when you look at a district like Masaka, you know how much it has been affected by HIV and AIDS.
Yes.
Now imagine a situation of a woman with a disability who is struggling with HIV and AIDS, and then the reproductive health issues, not accessing this and the other. We had a criteria. So basically we are focusing on ordinances. Ordinances, these are provided for in the Local Government Act, and they are made as laws at district level, emphasizing issues of sexual and reproductive health rights and needs of women and girls with disabilities. And we have a legal officer who is heading this program. And we are about, to finish up. By the close of this year, I think we'll be done. Then we are also focusing on budgeting. Why, Jamila, we came up with this thing of budgeting? Of course, we knew that now we have got a ground, we have got a basis. That is
You've selected the areas.
Yeah, but the basis I'm talking about is the provision in the Public Finance Management Act, which requires gender and equity sensitive budgeting. That we say let us use that provision. Because, you as a women with disabilities, we have been going to hospitals, we have been finding the facilities in the antenatal wards, say the examination beds. For you, the examination beds, the weighing scale, the labor beds in the in the labor suits, the toilets and whatever. All those ones not accessible and not friendly. So we are asking ourselves, for example, a question: how much does a labor bed, an accessible labor bed, cost? So that it becomes so difficult for the Minister of Health to put it in the hospitals.
At least one per hospital.
At least, we said let us look at the budgets. Maybe we compare with other facilities in the hospitals. But what we realized was that, the thing was not very costly.
Yes.
Then we gained the energy to advocate for their procurement. But the good news we have to share with the entire community, and especially the community of persons with disabilities, Honorable Minister Ruth Acheng, the Minister of Health, has confirmed to Huriwit and to myself that with the support of the World Bank, they are going to procure accessible labor beds for mothers with disabilities, starting with the level 4, Health Center 4, and also the hospitals.
Yes.
And then
when is that going to be done? I
think with this financial year.
Within this financial year.
Yeah. So we passed, even I remember we passed some money in the World Bank support. Two, something which we can also happily report to our funders, Amplify Change. The labor beds for mothers with disabilities have been put on that checklist of essential equipments which must be in the hospitals. So the Minister of Health, when it comes to the health center or the hospital, to check the essential items which must be there, the accessible labor bed for mothers with disabilities is one of these. Don't you think this is a very big achievement?
That's very, very good news, Honorable. And you know what? Come next year, when the budget is about to be read, I'll still come back and call you here, and you give now the real accountability, because you have mentioned it. The listeners are out there, the people living with disability. You heard what Honorable said, that at least now you should feel okay that when you're pregnant, you are sure of getting good labor. You go and you are dressed well, and you don't have to struggle, and you also burden your husband and the relatives. But Honorable, just a minute.
But have you said that? Now that we have got a decentralized structure of governance, where we have councillors representing persons with disabilities, they must now be on the lookout to see that these beds are really procured and they are placed in the hospital. And
that is why I was going to come to my sister Mariam. Now, you as a social worker, you have heard what Honorable said, and I know that you work closely. So far, within the central area that you work from, what can you tell us about people living with disability in terms of sexual reproductive health rights?
As Hajat has mentioned, that when we got this grant, we went ahead in those districts that she has mentioned, and we found lots of challenges when we did the baseline survey. Well, one of the challenges we found was, as she has mentioned, was inaccessible beds. Another challenge we found was that of sign language interpreters, that we have advocated for having sign language interpreters be in hospitals, and it's one of the biggest challenges. Another challenge we found was that of information is not accessible, inaccessible formats. You find that most of our mothers, they are illiterate. Most of them have not gone to school, and accessing this information is a challenge. However much, whether it is to do with family planning, in most cases, information to do with family planning, it's put on charts.
Yes.
And when they go to these hospitals, they can't read it because at times it's not in probably in their own mother languages.
Yes.
Now, for those with visual impairment, you know, it has to be brailled, but you find that even the medication is not brailled, so they find very, very difficulty in accessing this information to do with health. And another challenge we found was that because long distances to the health centers, that you find that most of them have resorted to
using the
traditional healers, the one they call Mulera. They don't know birth attendants.
Yes.
Because, you know, thinking about going to the health center is a bit far, and most of them even do not have the accessible equipments. For example, they lack wheelchairs, others they don't have guides. At times even the guide is not there to, to escort them to these health centers. So those are the challenges that we're having in SHR8. And another one is maybe the issue to do with confidentiality. That you find that when they go to these health centers, there's a lot of negative attitude towards mothers with disabilities. And you know, when you go to a hospital and you don't feel welcomed, you will not go back.
Next time you'll say, I think, let me look around.
Let me look around, So that has really impacted a lot to do with accessing health.
But again, I want to come back to you as a social worker. You know, one of the issues that is coming up, I think Honorable can agree with me, is in the part of, in the group of people living with disability, there is an issue of depression. Depression is becoming a serious issue because people have so many issues they go through in life. And I remember I had a training with the Butabika Hospital on reporting about people with health problems, especially mentally disabled people, and it's on the uprise. I bet if you went to Butabika right now, you'll be shocked that a person maybe you saw the other year is actually there. And what have you done? Because there is a lot of stigma. There is a lot of stigma surrounding these people. But you as a social worker, maybe you can take us through for just Kampala, because sometimes you find someone is coming from hospital, from Butabika, and they're actually in a green outfit, and you know that anyone who's in a green outfit must have actually come out. So can you take us through that?
Actually, what we've done is that we organize groups. These people organize them in groups to share. You know, it's very important when they share. So when they share, they come together, they talk about their issues, and we bring in role models. For example, people who have gone through what they have to go through, and they share with them. And what we do is that we've trained counselors with disabilities, because most of them find confine into people with disabilities to talk about their issues. So we train counselors who are people with disabilities to go out in communities to share with these people.
Okay. Now I want to get back to yes, Honorable, I'm coming back to you. In this program, as we had started earlier on, it is about Ask Your MP. I know most of you are wondering, the MP is here, and then there is Madam Mariam there, but these are all leaders, and you know, we want to give you opportunity to understand. Apart from understanding, asking the Member of Parliament, we also want you to understand about people living with disability on the perspective of social work, because people living with disability, as you have heard from our guests here, they go through a lot. That's why I see Honorable is trying a lot to make sure that at least these people are attended to. Especially the good news that I've had that has really made me happy is the issue of the beds for the mothers, because you know, maternal health it's something that is very serious in our country right now. But now, Honorable, before I bring back Honorable, we're about to end this program, but I want you to go on our Facebook page and please ask us any question, and then we shall deliver it to the Honorable. But for now, Honorable, you were going to say something? Yes.
You know, the issue of maybe we call it psychosocial or mental disability is actually on the rise, and it has actually attracted international concern. Last week, people with disabilities from all over the world gathered in New York for a meeting to discuss the convention, the UN Convention on the Rights of Persons with Disabilities, and how member states of the United Nations are actually, you know, implementing the convention. But one of the, I was not in New York, but I was following. one of the issues which was high on the agenda is the issue of psychosocial disability. And actually for us as human rights of women and girls with disabilities, we have picked up that issue. Because, Jamila, imagine when you have that kind of disability and then you are carrying a pregnancy.
Exactly. Oh God, yeah. I can just imagine.
You see? And then maybe labor comes.
And you don't even understand what is happening.
That's why we are really asking our funders, Amplify Change, to help us with more funding, because the issues we are dealing with related to sexual and reproductive health rights and needs of women and girls with different disabilities are very wide.
Yeah.
But on the side of Parliament, I think, I remember it was last year, could be last year, we amended the Mental Health Act.
Yeah.
It was very old, even older than maybe all of us here.
Yeah.
It was so old. It was enacted in the early 60s.
It was in, I think, about 1960, 63, 64.
Yeah. It was so old. So we amended it. But I remember, you know, it had very complicated, you know, terminologies. And some of my fellow members of Parliament were saying, "But Safia, we are going to leave you with your bill," because, you know, some of these terminologies are complicated.
Yeah.
But the Right Honourable Speaker stood with us, and then we amended this bill. But one of the issues also of concern was the way people with mental illness were being treated. You know, they are looked as a danger to the community, and you know, they want to be according to the way the disability is going to be managed, was perceived to be managed. People were taken away from their communities and taken to segregated places. And we are told that when they are taken, they were put into darker rooms, and then they used the electricity, and you know that was being said. But I was not there. But for when we are amending the Act, the Mental Health Act, we really strongly advocated for those the people living with mental disability to live with their relatives in the communities.
Honorable, I'm so sorry the time is up, but I really wanted to know more about, there are so many issues that you've talked about that I would really want to follow up. And probably at an appropriate time, we shall still call you back, and Madam Namboze, Mariam, and also maybe come with a gentleman so that we have
balance, gender balance.
Because we are here advocating for gender issues, and yet we are all women.
And we should bring men on board.
Yes, we should bring men on board. Like the way the HIV/AIDS slogan is, make sure you bring men on board, and it has actually worked.
It has worked,
So, Honorable, I'm just going to give you, I think, about 40 seconds to just speak to your voters.
I thank persons with disabilities for electing me to this position. But I would like to call upon them that whatever I succeed to do in Parliament, and whatever I succeed to do under the human rights of women and girls with disabilities, you join me, and we make sure that we reach out to as many persons with disabilities as possible.
Thank you very much, and thank you, Madam Namboze Mariam. I'll definitely follow up. You being a social worker, I'm very interested in how you're going to work with the MP to make sure that whatever she's advocating for with all this passion is actually implemented. So I want to thank again people who are watching UBC TV right now, Ask Your MP program. It's been a pleasure having Honorable Nalule, Juuko, Safia, Hajat, I will say all those names. And as I told you earlier, I will not say Namboze, but Namboze, Mariam. So thank you very much, and please keep tuning in until next time when we meet again here for Ask Your MP. And I believe next week we shall also bring you another person, maybe another leader from another sector, but still the MP. My name has been Oluka Jamila, and you've been watching Ask Your MP. Have a good night.